Bismillahirrahmanirrahim. Rabbi zidni ilma. Assalamu alaikum everyone. My name is Dr. Sadia Rafiq, and under the supervision of Professor Dr. Sahara Afzal, today I am going to present the critical appraisal of a review article, and its title is Safety and Mode of Action of Diabetes Medication in Comparison with 5-aminolevulinic acid, which is 5-ALA. The checklist which I'm going to use is short checklist. Starting with the abstract, 5-aminolevulinic acid is a delta amino acid naturally present in every living cell of a human body. 5-ALA is produced in the mitochondria as the first product of porphyrin synthesis pathway and composes heme. Exogenously supplemented 5-ALA helps in upregulating mitochondrial functions. Mitochondrial dysfunction has been associated with the pathophysiology of diabetes mellitus. Thus, in this review, we evaluate the mechanism of action and adverse effects of common medications used to treat type 2 diabetes mellitus, as well as 5-ALA, including its mechanism and possible use in diabetes management. Starting with the introduction of this article, diabetes mellitus is a multidimensional disease with various contributing factors, including genetics, diet, race, and lifestyle, and prevalence has steadily increased. In type 1 diabetes mellitus, there is insulin dependence, and people require exogenous supply of insulin, whereas in type 2 diabetes mellitus often develops due to obesity and lack of physical activity, which results in insulin resistance. So insulin is needed to regulate blood glucose level. The effect of persistently high blood glucose level have been well documented and include atherosclerosis and neuropathy. The diagnosis is made with the random or fasting blood glucose level as well as glycated hemoglobin A1C levels. For following diagnosis, patients are counseled on the importance of diet, exercise, and weight loss if applicable. So the first line therapy in type 1 patients is insulin therapy, and in type 2 diabetes, we have different medical options. And the hemoglobin A1C are generally used as a guide for the glycemic control in diabetic patients with level less than 7% as a common target. Talking about the diabetes medication. The American Diabetes Association Standards of Medical Care in Diabetes Patients specifies the pharmacological management of type 2 diabetes, all of which are discussed below. Number 1 is metformin. Metformin is the most common initial drug prescribed for type 2 diabetes in the world. Metformin acts via an anti-hyperglycemic pathway through an increased glucose tolerance in patients with type 2 diabetes. Second group we have are the sulfonylureas. These are basically beneficial to patients who have retained some degree of residual pancreatic beta cells functionality as they work by stimulating insulin secretion. Third is meglitinides. They act on different beta cell receptor but in similar fashion to sulfonylureas. Next are thiazolidine diones. They effectively attempt to mimic insulin by reducing hyperglycemia. Next group is GLP agonists. These are the glucagon-like peptide agonists. Our incretin is a gastrointestinal peptide involved in the regulation of glucose level, where the hormone is released upon consuming food. Then there's GPP4 inhibitors. Then there's sodium glucose co-transport 2 inhibitors, alpha glucosidase inhibitors, and orlistat, which are lipase inhibitors. Basically, the functions of all these groups have to decrease the blood glucose levels. So after food is consumed and digestion begins, glucose levels start to increase, as do other hormones such as glucagon-like peptide, which is GLPI, which is released in the intestines. Glucagon-like peptide 1 is an incretin which works by triggering insulin production as insulin acts to decrease glucose levels and inhibiting glucagon production because glucagon acts to increase blood glucose level. This occurs to counteract the increased glucose, and it induces the feeling of satiety and reduce appetite by sending signals to the brain that one is full. The consumption of food also triggers the release of pancreatic hormones like insulin, amylin, and glucagon. Insulin and amylin both work to decrease glucose levels and inhibit glucagon, while glucagon acts on the liver to raise glucose levels. Overview of the pharmacological management of type 2 diabetes. If after 3 months inadequate control persists, like hemoglobin A1C is not targeting levels, and additional medication should be added after assessing the atherosclerotic cardiovascular disease. So there would be two categories: if the patient have ASCVD or if the patient does not have ACVD. Choosing a drug should be tailored to the individual, taking into account factors such as its efficacy, adverse effects, benefits, expenses, patient's preference, and overall health, kidney and cardiovascular well-being, hemoglobin A1C levels, glucose readings, and weight. Studies have shown the efficacy of reducing the hemoglobin A1C level is similar between the different classes of drug, with the reduction of approximately 1%. The relevance of mitochondria in diabetes. Mitochondria are fundamentally linked to the various interconnected pathway to diabetes pathogenesis. The mitochondria generate energy via electron transfer. At the islet's beta cells level, insulin release is controlled by mitochondrial ATP production, which is produced by the electron transfer. So the mitochondrial dysfunction thus decreases ATP and decreases the stimulus secreting coupling in pancreatic beta cells, which has been suggested in the pathology of type 2 diabetes. In addition, mitochondria produces reactive oxygen species ROS, which may contribute to the long-term deterioration of insulin secretion and could be involved in the autoimmune destruction of type 1 diabetes. So the generation of ROS may also interfere in insulin signaling in muscles, contributing to insulin resistance. And in type 2, there is, moreover, the mitochondrial function has been shown to affect insulin sensitivity in muscle and liver. So genetic mutations such as messenger DNA deletions can lead to much rarer cases of mitochondrial diabetes. So in patient with type 2 diabetes revealed, the mitochondrial complex 1 activity was reduced by approximately 40%. So mitochondria has a very special connection with the diabetes. If we see the depiction of mitochondrial electron transfer system, it is the mitochondrial outer membrane, it is the inner membrane, it is the cytoplasm, and you can say by the whole process, it goes on the release of electrons, and at then ATP and then ATP is produced. Now talking about what is 5-aminolevulinic acid. It is a natural delta amino acid present in the human body, which is synthesized from glycine succinyl-CoA by mitochondrial ALA synthase in the mitochondria of animal cells. So after the process of polymerization, everything, heme is then generated by the insertion of ferrous in the mitochondria and then carry out electron transfer in the mitochondrial inner membrane, and which is coupled with TCA cycle and produces ATP. Studies have suggested that 5-ALA enhances aerobic energy metabolism, especially cytochrome C oxidase activity, as well as protein expression in the mitochondria. So it also generates cytoprotective products such as bilirubin and carbon monoxide, and has been shown to play a role in reducing hyperglycemia in several diabetes models. 5-ALA stores in human body decreases with the age, leading to decrease this expression within cells. And the second thing is, several studies have proven the normal doses of 5-ALA supplementation in both animal and humans, as well as anti-inflammatory effects. If we see the biosynthesis of heme in mitochondria of animal cells, this whole process goes out. Metabolic pathway 5-ALA in mitochondria. Here, to the process it goes, and then there is a production of heme, which helps in hemoglobin formation later on. So talking about the critical appraisal about the introduction. Title: It is not clear. The study setting is not mentioned. The study style is not mentioned. The place. So it is an average title. It's not clear. The abstract is given, which was without any heading, and it's quite short and inadequate. An introduction, scientific background about diabetes, its risk factors, diabetes medicines, their mode of action, about ALA is given, and rationale for the investigation is also being reported. Specific objective is also mentioned. Moving forward, the use of 5-LA in type 2 diabetes. There was a study conducted on the mice demonstrating the subject is heterozygous for HLA synthase gene. So in the study, there was the deficiency resulted in heme deficiency. Because of the deficiency of 5-HLA deficiency resulted in heme deficiency. Because of decreased glucose uptake in the myocyte of mice with the absence of HLA-SA or those with a block in heme synthesis, ultimately suggesting that ALA deficiency in vivo can lead to impaired glucose level and insulin resistance. You can see that it was the age of the rats and it was the level of ALA production, amount of it. And you can see in the liver, heart and liver, as the rat's age, it decreases. So the decrease of 5-LA synthesis with age, the amount of 5-LA produced in the human body decreases with age. Aging might occur because the amount of heme decreases and the use of nutrition and oxygen for energy production becomes inefficient. This is the table of the clinical studies for evaluation of safety and efficacy of 5-LA and sodium ferrous citrate on pre-diabetics and type 2 diabetes mellitus object. These are the oral hypoglycemic agent. So in this review, 4 studies are included, one was done in Hawaii study, and it included the pre-diabetics. Then the Hiroshima study included pre-diabetics, and Tokyo study and Bahrain study, which took type 2 diabetes mellitus patient treated with oral hypoglycemic agents. So first of all, Hawaii study, a double-blinded randomized prospective parallel group study in Hawaii was conducted on 154 individuals who were pre-diabetic, with the hemoglobin level of 5.8 to 7%, hemoglobin A1C level, which were randomized equally to 3 groups. Number 1, low-dose 5-LA supplement, which was 15 milligram. The second was with 50 milligram, and third control group with the placebo capsule of identical size and color. In those taking 5-LA supplement for 3 months, 2 hours post-oral glucose tolerance test levels declined significantly compared to those taking the placebo. P-value was 0.02. There was a strong correlation in those with baseline glucose intolerance with 2-hour post-OGTT glucose measurements greater than 140 milligram per dl. Like p-value was 0.005 and p-value was 0.002 for the low and high dose group respectively. Some trends were observed for hemoglobin A1C, but results were of borderline significance. So another study was conducted in Japan with an individual who demonstrated mild hyperglycemia, in which it was for between 105 to 125 milligram per dl, and the level was 5.8 millimolar to 6.9, or hemoglobin A1C level was this. They were randomly assigned to 4 groups with different doses of ALA. The result showed reducing fasting and 2 hours post-OGTT plasma glucose levels after 3 months. And both studies reported no adverse effect. So these were the studies conducted on humans, on pre-diabetics. And then there was a study on the metabolic effects of 5-LA and its use in the diabetes was performed in Otsuka Long Evans Tokushima fatty rats and intragastric doses of 20 and 300 kgs for 6 weeks. The result showed improved glucose tolerance, hypertriglyceridemia, and hyperleptinemia in rats as beta rats than the administration of equivalent dose of metformin in accordance with reduction in food intake and weight. So an additional single-blinded randomized placebo-controlled parallel comparison study in Japan was done to determine the safety of combined use of 5-ALA-PSFC, which is 5-amino-levulinic acid phosphate, sodium ferrous citrate with oral hypoglycemic agent. It was done in type 2 diabetic patients. including the potential for hypoglycemia. 45 patients were randomly assigned to receive this, and they again follow them for 12 weeks. They were given, and then they observed that their levels were definitely decreased, and there were no side effects in it. So, a prospective randomized single-blinded placebo-controlled dose escalating pilot clinical trial assessed for the safety of this per day, and the study enrolled 53 patients living in Bahrain with type 2 diabetes that was unresponsive to the use of one or more anti-diabetic drugs. There were no significant difference in incidence of adverse event reported. The most common event reported being gastrointestinal in nature, consistent with the known safety profile of 5-HLA patient in diabetes. So, no significant changes in laboratory values and no difference in hypoglycemia between patients seeing 5-LA and placebo were noted. Overall, the current results support the use of 5-LA with CFSC up to 200 milligram per kg taken in 2 divided doses is safe in patients taking concomitant oral anti-diabetic medication and may offer benefits in the diabetic population. So the next is when used in tandem with other forms of diabetes medication, 5-HL is expected to estimate insulin sensitivity in patients who are deemed insulin resistant. So as described, all the medications currently used in the treatment of diabetes exhibited adverse effect. The benefit of using 5-HLA would be the absence of such side effects. Like if you see, it is the hemoglobin A1C level, and it is a start of HLA. These are the days, and these are the antibiotic drugs, concomitant medication, metformin and gliclazide, dose level, and the duration of diabetes in both cases of more than 7 years. It was a typical case of Bahrain study. Hemoglobin A1C in the patients under long-term therapy with high maximum doses of oral hypoglycemic agents were dramatically improved by 5-LA SFC supplementation, and it decreases from 8.6 to 6.1 in 12 weeks. So there very much adverse effect of the drugs and the safety and tolerance shown in the clinical studies. So further studies but there's a less side effects with the use of ALA. But further studies are needed to show the efficacy of 5-LA in the treatment of diabetes, including factors such as reduction of hemoglobin A1C levels. Regarding safety, HLA have been avoided in patients with porphyria due to pathophysiology of the disease. Generally, studies with 5-LA have a consistent lower level of adverse event, with some studies reporting no adverse side effects. So it is a summary of type 2 diabetes medication, their adverse effect and severe adverse event possibilities. So if you see the 5-LA, its side effects were like common cold symptoms, menstrual pain, diarrhea or headache, and severe adverse events were none. As compared to all the medicines for diabetes used, they have the severe effects, and as well as the severe adverse effects could be like lactic acidosis, could be there, pancreatitis, and list is so long. At the medication currently used in the treatment of diabetes, adverse effect, the using of benefit 5-HL would be absence of such extreme adverse and its safety and tolerance have been shown in clinical studies. It would be comparatively cheaper compared to some of oral hypoglycemic agent. Further studies are needed to show the efficacy of 5-HL in the treatment of diabetes, including factors such as reductions of hemoglobin A1C levels. Then the regarding safety, HLA has been divided in the porphyria, which I've already mentioned. So in the conclusion of the article was that there are various means, anti-diabetic medications reveals that there are various means through which glycemic control can be achieved in the human body. Each class of a drug has a different mechanism of action, potency of glycemic control, and adverse reaction. Mitochondria plays very important role, and it is very important in the pathology of diabetes. So the mechanism of action is 5-LA is amino acid. It produced in the mitochondria, and a newer supplement that has recently emerged on the market containing 5-HLA. And its effect on the mitochondria and its other metabolic activities is also seen in the heme oxygenase expression and cytoprotective products. So such findings suggestion that association between diabetes and mitochondria could be utilized in managing type 2 diabetes, especially given the evidence of mitochondrial dysfunction to increase related risk factors. So this is supported by the recent study showing the safety of 5-HLA supplemented in the diabetic population. And it could be it could lend a supporting role towards a successful treatment of diabetes in the future. The conflicts of interest, the author declares that there is no conflict of interest regarding the publication of this paper. And acknowledgements, we would like to acknowledge SBI Pharma support and aid in publishing this paper. So it was all about the article, and now moving towards the short checklist. I will address questions one by one. First, A1 was where the criteria used for deciding which studies to include in the review period. So the authors just specified the types of the studies, the participants, settings, and the populations, intervention, drugs, randomized control trials were done, and the outcome is mentioned. So in this column, yes, it was the mentioned, all things were mentioned in it. Next was the search for evidence reasonably comprehensive? In this, there was not applicable all the things. Language bias was not avoided because all studies were in English. No restriction of inclusion based on publication. The positive finding which I found in this was the reference list in included study was checked and it was given. So yes, partially. There was one option which was according to show list was present in this article. Next was, does the review cover an appropriate time period? So is the research period comprehensive enough that relevant literature is unlikely to be omitted? Yes, because the main thing was about diabetes and a large information literature reviews already available on the net databases. So yes. Was bias in the selection of articles avoided? In this article, only list of included study was provided. So yes, partially. Did the author use appropriate criteria to assess the quality and risk of the biases analyzing the study that are included? Basically, in this study, the table was given in which the 4 studies which are included are mentioned, and in the reference, the link was given, and further we can go on that link and can open that. So the partially it was given in this, the other was not applicable on it. Then the B1 question is, were the characteristics and the results of included study reliably reported? No, because there was just a reference in the reference of these studies, but as such, no table and anything was not given about 4 studies specifically in this article. Are the methods used by the review author to analyze the finding of included studies clearly, including methods for calculating effect size if applicable? Yes, you can say, yes, we can say partially, because in the 4 those studies which are included, they have given told about their setting, their sample size, their duration of giving them the drugs and everything. Yes, so it was present. Did the review describe the extent of heterogeneity? In this, it was a review article, so it is not applicable over there. Were the findings of relevant studies combined appropriately relative to the primary question, the review address, and the available data? Basically, it was a descriptive study only, and no analysis was done, so it's not applicable. However, the study is weighted as it's not applicable. There's the review address unit of analysis. So basically, it is only descriptive one. Does the review report evidence appropriately? It's not applicable in this review article. Did the review examine the extent to which specific factors might explain differences in the result of the included studies? Basically, it was a descriptive sort of study, and there were some graphs and pictures were given. So partially, yes. Are there any other aspects of review not mentioned before which will lead to question of the result? The conflict of interest, which I have mentioned, is mentioned in this review. And the last one, are there any mitigating factor which should be taken into account in determining the review reliability? Limitations are ignored because they have said the further studies are required to prove the role of the HLA, and there was no strong policy conclusion drawn in this from this article, including abstract and summary. So overall, according to my critical appraisal, the strengths are it's a beautifully written with scientific background review article, rationale is adequate, randomized control studies were included, population and study settings were different, animal studies were also included, reference list of included studies were provided, table was given of all drugs, their mode of action and adverse effects. A table of included study was also given, and the sample size of included 4 independent study was appropriate. And the limitations were, title was average because it was not self-explaining. Abstract was given but was too short and inadequate. did not mention search databases in the article. Independent screening by two reviewers was not mentioned. Quality appraisal tool or checklist of included studies not provided. It was descriptive and no statistical analysis was done. And this is our YouTube link. And thank you so much.
Thank you very much, Dr. Sadia. This is just a treat to our hearing and listening. A beautiful presentation and very well described article. This article is one of a brilliantly written article. Why? Because we have been dealing with diabetes now for many years. And according to the latest guidelines of American Association, AMA, now the diabetes should be treated at primary healthcare level, and every doctor who is MBBS must know how to deal with diabetes. Pakistan is among those countries where there is a very high burden of diabetes, and it is documented that there are 14% patient of diabetes mellitus type 2. They are present in Pakistan. However, if we make our data more robust, reliable, and collect it at certain places, we know that we are nearly more than 20% of having burden of diabetes, and the prevalence is more than 20%. This diabetes that is causing lots of complication, and a new thing is about the mitochondrial role in diabetes. Mitochondria is very, very important. As we all know, the diabetes is a metabolic disorder, and mitochondria is called the powerhouse of the cell. Mitochondria is one of the very important organelle that has been transferred from the mothers to the offspring. As we know that in egg, there is mitochondria. However, in the sperm, there is no mitochondria is present. So it is the mother who is transferring mitochondria. Now, the role of mitochondria in causing diabetes that has established another important thing that the diet of the mother, the nutrition of the mother, is very important in providing the mitochondrial enzymes and mitochondrial heteromaterial to the offsprings and to the future generations. The third important point that has been highlighted is that there are drugs that can act on the metabolic pathways that are occurring in the mitochondria, and they can play a very important role in controlling diabetes. They are safe options, they are cheaper options, and they are cost effective options. And one of those options is ALA. Again, one of a very important thing is that we are in the epidemic of diabetes, and if we have more cost-effective options, that would affect the population at large. Now, coming to the critical appraisal, the critical appraisal was very well done, and we would have another session for the detailed review of the critical appraisal. Uh, it is mentioned that how the articles were selected, and another important thing that a table was made for literature review, and that table has helped us to identify the studies and to go through those studies once again and finding their conclusions and how they have made their results better one. Another important thing is most of the randomized clinical control trials were included. So these are the multi-centric randomized clinical control trials. And as we know, in level of evidence, as we go to the higher level of evidence, we need multi-center randomized clinical control trial. The limitation is that the meta-analysis was missing. Yes, they have declared the conflict of interest that it is not present, but we want to know that in our cities where they were conducted in multi-centers, do they have any conflict of interest, any pharmaceutical company or any funding source that may cause the results skewed towards the ALA while they were conducting at other sites? Because when there are multi-center randomized clinical control trials, there is a more robust management of randomized clinical control trials. However, the quality checks, they has to be mentioned that how they have conflict of interest at their centers that can later on affect the data that has been published. Another important thing is that meta-analysis was not there. So the pooling of the data, the increase in the sample size, increase in the confidence interval, increase in the power of the test was not possible. Another important thing is that when they have combined their results in the form of graphs, it is being shown that they are more having the ALA being compared with other hypoglycemic agents. However, we want it to be compared more with insulin. And why? Because the insulin is one of the indigenous thing that is produced. And in diabetes, we know it is either the absolute deficiency of insulin or the relative deficiency of insulin, or there is resistance against insulin. So the gold standard should be insulin, and ALA must be compared with the gold standard. And the future studies can solve this problem, that if ALA is being given with insulin or without insulin, then how the things would change. So we would stop here, and we would again have to click this link in order to have discussion among all our postgraduate students and to take their input. Thank you very much once again, Dr. Sadia. Wonderful
Thank you, ma'am.
presentation.
Thank you so much.
Thank you. Allah
Allah
Hafiz.
Allah Hafiz.